Good morning, everyone. Thank you so much for joining us for our Facebook Live this week. We are excited to speak with Dr. Erin Clark. She is our Division Chief of Maternal and Fetal Medicine. And we are going to be discussing everything COVID as it relates to pregnancy, including vaccines and whether or not pregnant women should feel safe and comfortable getting vaccine now that we're up and running with getting those for our patients. So Dr. Clark, I had spoken with you doing our Facebook Live. I feel like it was in many ways years and years ago, but I looked back and it seems like I spoke with you back in May. And at that point in time, we were learning still a lot about COVID, a lot about the best way to treat patients, but everything seems like it's a different world when you're pregnant. And we talked about how, even though the world was changing so quickly around us, one thing that is never going to change is that women are always going to be having babies, right? So you and I were just talking a little bit about how things have changed, but why don't you quickly, just sort of introduce yourself and talk a little bit about maybe how things have changed since that time when we spoke last spring about how we are treating patients as they are pregnant and kind of throughout their pregnancy, now that, what we've learned over the past almost year now of seeing patients through their pregnancy during this time of COVID.
Yeah, thanks, Suzanne. I appreciate that introduction. It does seem like so long ago, and yet just yesterday that we were having the conversation about what COVID means in pregnancy. And I think at the time that we last talked, we were really sort of saying, gosh, if this is like other viruses in pregnancy, pregnant women have a risk of being more severely affected. But at this point in time, we don't know that that's the case. We didn't have much in the way of direct information about COVID in pregnancy in May. But since that time, quite a bit of additional information has come out. And now the best data suggests that, that pregnant women that are at increased risk of getting severe illness with COVID-19, pregnancy is a definitive risk factor, in other words, for getting severe or critical illness. And that pregnant women who get COVID-19, if they happen to get severe or critical illness, are at increased risk of obstetric complications. So I think that data has evolved over the last several months such that we now feel very confident saying that. Pregnancy in the time of COVID remains challenging. I mean, I always tell people, pregnancy, parenthood, childbirth, these are all sort of leaps of faith in the best of times, right? You sort of leap into them, you don't know where you're going to land. They're always a cause for anxiety and uncertainty, and those things are just magnified in the time of COVID. You've added one more thing that adds uncertainty. So it's been a challenging time for our mothers, for our families that we take care of. And we've been trying to walk them through that process as best we
can. Let's talk before we get into some of the specific questions, just about the basic protocols. So say you have a new patient who has just recently found out she's pregnant that is going to be working with you or someone up here at University of Utah Health. What is her pregnancy going to look like?
So in many ways, it will look and feel like normal pregnancy care, but there's no question that we are doing more virtual visits. I mean, when we met, we were probably even doing more virtual visits in May than we are now because we've sort of settled into this new normal. But virtual prenatal care visits, have been shown to be safe, effective, and add flexibility. And in the time of COVID, reduce the risk of exposures that are related to coming into a healthcare system and seeing other patients and other providers. So almost all of our pregnant women will do some proportion of virtual visits for their prenatal care. We leave it up to patient choice, but most places around the country are still doing some virtual visits as a way to do risk reduction. So that's the main way I think that pregnancy care feels a little different. That and the fact that every time you come into the office, it seems like we're talking about, okay, what's new in the COVID world? The latest topic has been vaccinations. Our visits are now, we have these bullet points that we cover during every visit, and COVID and what's new are now one of those bullet points. So we're spending some distinct time and energy talking about these topics with our patients.
Let's talk a little bit about protocols for delivery. Um, and I think they may be the same about as they were last time we spoke, but I just wanted to just kind of discuss a little bit about support person and kind of how we're managing that. And I know that this has changed over the last several months a couple of times, but kind of what that looks like, and also visitors, or kind of what that feels like now during delivery as opposed to what it did pre-COVID.
Yeah, I mean, the advantage of time is that we actually have learned some things about um, exposure to COVID and how to mitigate it. And I think when we last talked, I think we were in a time when visitors outside of the primary support person for labor were not allowed. And actually, most places have loosened up those rules a little bit as we realize how effective masking is, and we're testing pregnant women before they come in for delivery for COVID. And those things have reduced the risk a lot. So we're actually allowing 2 people to accompany a woman on labor and delivery and postpartum, and care providers like doulas and midwife support are outside of that total tally. Everywhere is different. I can't speak for every hospital system, but I'd say the trend is people went from very strict restriction of visitors to loosening things up to something that's more humane, that still supports a woman and her family in labor, and is something that we can live with for a longer period of time. I mean, those very strict restrictions that we had to implement at first because we lacked some of the understanding about how best to prevent disease were really hard on patients and families. So we've been able to loosen up a little bit to give people more of a normal experience that they expect.
Another thing we had talked a lot about back then, which also is changing and, thankfully I think is getting to a lot more positive place, is the importance of, how to, once you get home with baby, kind of introduce baby to outside family and grandparents and all of that, and how difficult that was when you can't really have grandparents face to face. And I think now with the potential that a lot of people over 70 are now being able to be vaccinated, at least in Utah, I think that might be a little bit better. But what are some of your best practices now for being able to introduce the newborn once they're home to other members outside of the immediate family?
I mean, in the absence of vaccinated individuals, I mean, this is an excellent question because it's what families grapple with, right? They want to introduce this new family member. But outside of vaccinated individuals, our recommendations are really the same, that we need to be really cautious because there's still the opportunity to transmit COVID to a newly delivered mother and her baby. So there's no uniform answer, Suzanne. People have to sort of decide for themselves what the right answer is for them and for their families. Some people are waiting for that introduction to occur later. Other people are doing it over Zoom. Other people are doing it, at a safe distance. Our weather, as of this week, is not very conducive to an outside introduction. People were using that as a mechanism too. And other people were coming into an indoor setting but being masked. That is a higher risk, but again, every family has to make those individual decisions. I do think now that more grandparents are vaccinated, as a vaccinated individual, I think that is a more comfortable, safer introduction setting. Nobody knows whether you can be an asymptomatic carrier of the virus once you've been vaccinated, but everybody agrees that that is a safer situation when you have vaccinated individuals in the formula. But families still have to take that information and the information that we talked about in order to make the decision for themselves. It's just one of the challenges of being a new parent in the time of COVID.
Right, of which there are many, as
of which there are many.
Yeah, just throw another one onto the pile. Okay, so I wanted to just open up the subject of vaccine, which we've been talking about a little bit before we started. And I was telling you how when the vaccines first came out, we're just getting so much information thrown at us. Every day it seems like there's something new. And I mentioned to you how when the vaccines were first happening, I saw a couple medical providers on Twitter who, were brave enough to post, I'm pregnant and I'm a medical provider and I got the vaccine. And they put that up on Twitter, with the hope of, I think, probably educating others. But almost immediately, those women were attacked for, how could you do this? There's not enough information out there. And, my takeaway from that was there's not enough information, for one reason, because pregnant women hadn't been included in the clinical trials. So that was one thing I wanted to ask you about, just sort of your thoughts on that. And could you also explain, for people watching on Facebook, why is that pregnant women hadn't been included in those trials up front? Is that standard? Do you have thoughts about that? And then we can talk a little bit more about kind of the implications of that. But I just wanted to ask you about that to start.
Yeah. So I always embark on the vaccine conversation by saying, look, there's things that we clearly know work and are safe in terms of risk reduction: masks, social distancing, washing your hands. And then there's things that fall into a category that we have some uncertainties about. And vaccines in pregnancy are in that category. You are right that pregnant women were not purposefully included in the randomized trials. There is lots of controversy over that. And many people have advocated, many organizations have advocated for pregnant women, saying it's really important to include women in those initial trials so that we know how to counsel them. They're excluded, of course, because people are wanting to protect pregnant women and their fetuses and their children to come. And there's controversy over whether that is the right approach. In the absence of direct clinical trial data, we have to weigh risks and benefits as we best perceive them with imperfect data for being vaccinated and being not vaccinated in pregnancy. And I'm just always careful to point out to people that it's not risk versus no risk, right? It's risk and benefit of vaccination versus risk and benefit of not being vaccinated. And that is a very hard formula to determine what the best answer is when you don't have direct clinical trial data. But this is why there's controversy, and this is why there are strong feelings in both directions, because we don't have perfect data. That said, there were some pregnant women who were included in the trials inadvertently because they were pregnant and unbeknownst to the people in the trial who were enrolling them. So we have some data from that. As Dr. Anthony Fauci recently pointed out, we now have observational data for more than 10,000 women who have received COVID vaccine in pregnancy, who have elected to be vaccinated in the US. And we have growing animal data that is giving us some reassurance about the safety of vaccination in the various trimesters. So that data has largely been very reassuring. Dr. Fauci put it as there's been no red flags seen among the pregnant population. The animal data has been very reassuring, but in the absence of direct clinical trial data, there's still a knowledge gap there. And so that's where people have to kind of weigh the risk and benefit in each camp. And when I talk to pregnant women about their decision to vaccinate, we talk about their individual exposure risk. Where do you work? An ICU worker may make a very different decision than someone who works from home. What are your medical comorbidities? Are you someone who is a sort of fragile diabetic? You have high blood pressure? Are you overweight? Do you have other risk factors that would make you more likely to have severe illness with COVID if you were to get it? And who do you live with? Do you have other vulnerable people at home? The data in terms of like vaccine safety, mostly the theoretic risk that people worry about is the risk if you get the vaccine of a high fever in the first trimester and the potential detrimental effect that might have on a growing embryo. That hasn't been definitively shown to have any harm, but it's a theoretic risk that people bring up. And so some people who are saying, I want to be vaccinated, but I'm going to avoid that theoretic first trimester risk when an embryo is developing and a fetus is making all of its organs and such, and I'm going to opt for vaccination after the first trimester. But anecdotally, most people who've been offered vaccines so far are healthcare workers and teachers, right? Who we are taking care of. And so anecdotally, a lot of my patients have opted, because of their exposure risk, to get vaccinated in pregnancy. Not all, but most. And many have opted to even do it in the first trimester because of the safety data suggesting that we have at least confidence that it's very likely to be safe. Of course, they're weighing that risk with their risk of getting COVID and what those impacts might be in pregnancy. And every individual has to make that risk benefit assessment for themselves.
Okay, sorry, my internet is being a little bit spotty here. I apologize. That leads me to another question that this is probably a little bit theoretical, but and we are, I know, getting what I read this weekend, hopefully most Utahns will be able to get vaccine if they want it by hopefully late spring. But is there any scenario where you would foresee that pregnant women might be a prioritized group, given the fact that we have seen that they are at higher risk for potentially worse outcomes if they do contract COVID?
Yeah, I have not heard about how the state is going to handle those risk factors, but as they've sort of been doing it by age. Eventually, they might consider also doing it by medical comorbidities, and I would advocate for pregnancy to be included in that list, given the known risk of COVID-19 in pregnancy. So I don't know how they will handle that, but I think it is medically justifiable to certainly put them in that list of people who have increased risk.
Okay. Another question I had, as I recall from being pregnant, it seems like your body just does sort of wacky things anyway, and things tend to be exacerbated. So I'm wondering if from the patients that you are working with who maybe have been vaccinated, have we noticed or have there been any studies or anecdotal evidence of side effects maybe impacting pregnant women differently, or maybe being more impactful than we see in just the general population that you've heard about?
Yeah, so you're talking about side effects related to the vaccine, things that we've heard about like fever, chills, headache, people feeling tired or crummy for a day or so. And the data that we have so far does not suggest that pregnant women are more likely to have those symptoms. As far as we know, and data is accumulating, women are likely to have the same vaccination benefit as non-pregnant individuals, and they don't seem to have any additional side effects with either the first or the second dose. That's what Dr. Fauci was referring to when he talked about, we've now vaccinated many thousands of pregnant women. We don't see a safety signal. I think he was also alluding to the fact that we don't currently see that they're responding to the vaccine in any different way that we can differentiate right now. We're going to get more data when we have real clinical trials in pregnant women, and my understanding is that those are forthcoming.
Okay. Yeah, that was another thing that I wanted to ask, since we realized that hadn't happened early on. Is that happening, and when might we have some definitive data about that?
It's a good question. The question of when will we have that data looms large. I don't know. From what I understand, for the clinical trials that are being launched, they are just getting started. So it's going to be a ways down the road. What I tell my patients who have not yet had the opportunity to be offered a vaccine is that even if we don't have clinical trial data yet, if you are going to be offered the vaccine in 2 or 3 months, for example, you're still going to have the benefit of having lots of other people vaccinated before you, so that you have that information to then use in your own decision making. And I think some people have purposely paused with that in mind, saying, I'm just going to watch how this goes, and then I'll make a decision for myself. Lots of people are being vaccinated every day. So in very short order, we're going to have a lot more observational data to help people make their decisions.
Right. What about something we haven't touched on? What about lactating moms? In terms of being vaccinated, is that, and we probably don't know this either, is that something where mom can give immunity to baby through breast milk?
Yeah, excellent question. So all of the organizations that weigh in on these things say there's no reason that vaccination shouldn't be offered to lactating women. In other words, we have no reason to think that there would be biological harm. We have no reason to think that it would affect milk production. And there hopefully is going to be a benefit in terms of conferring some antibodies from mom through to baby to give protection. That's a mechanism that works for lots of disease processes, for lots of vaccines. We just don't know how well it's going to work for COVID yet. So the bottom line is we should not be withholding vaccines We should be offering vaccines both to pregnant women and to lactating moms, being especially reassuring and encouraging about vaccination during lactation. And hopefully we will be giving some benefit to both moms and babies by vaccinating mom when she's breastfeeding. How much of that effect we get remains to be determined, but it's worked really well for other types of vaccines.
What about pregnant moms who make a conscious decision that they don't want to be vaccinated at all throughout their pregnancy? What advice do you offer to them in terms of how to stay safe from contracting COVID? I mean, I'm assuming it's just basically what we're all doing, but is there anything else that you offer them in terms of reassurance of what they can be doing to make sure that they don't contract COVID while they're pregnant?
Yeah, the same central tenets that we have touched on. Really rigorous mask wearing. Some people are even advocating for double masking at this point, given the new variants. Distancing and hand washing. We are all fatigued, but so we just continue to reinforce that this is not over. We still have the same risks, and we might even have greater risks than we had before because of the new variants that are emerging that seem to be a little bit more infectious. So we're just reinforcing that those things remain really important. And then, just talking about the fact that even if they elect not to be vaccinated in pregnancy because they're unsure about that risk benefit for themselves, that we're encouraging them to be vaccinated once they deliver.
Okay. What about if a pregnant mom has already had COVID, maybe at a point before her pregnancy? Is she at a greater risk of contracting it again, or if she gets it, of still, having worse outcomes? Is that something that we have any data on or that we know much about?
We don't know for pregnancy at all. I mean, I think the data that we have so far suggests that perhaps if people have been infected before, even if they get reinfected, maybe with one of the new variants, which we have emerging data to suggest is possible, that maybe that disease is less severe than it would have been had they not been exposed to COVID the first time. But really for pregnancy, we have no direct data. What we're telling people is that if they've had a prior infection, whether it's in pregnancy or before pregnancy, that they should have some period of immunity, but we're not sure how long. So once they've passed, a few months past their primary infection, they would still be eligible for vaccination if they were within one of the groups that was being offered vaccination at the time. And since, again, we don't know whether people can still spread virus asymptomatically once they've been vaccinated, it seems unlikely, but we don't know for sure. We're telling them to do all the same things that the rest of us are doing for prevention.
Along those lines, what about antibodies? For a woman who has had COVID who is now pregnant, is there any evidence to show that antibodies could potentially be passed to baby?
That's the hope. I mean, I think the big question is, whether you've had COVID infection or whether you've been vaccinated, how well do those antibodies pass through the placenta and how well do they protect the infant? These are questions that hopefully, Suzanne, if we got together again at some period of time down the road, we would actually have more direct data to tell us. Right. But the hope is that if it works like other viruses, like other vaccines, there's at least some protection for that newborn conferred. That's what we all hope. But in terms of direct data, we are still very much trying to figure it out.
Another question I had, and I've heard a couple people that I've talked to that worry about this. And again, I'm asking you all these questions that I know we don't have data for yet, but it's just like you just said that maybe in the next time we talk, we might know a little bit more. I'm wondering about myths that you might be hearing that your patients are bringing to you, or myths / concerns about the vaccines or things that people have heard. I've heard a couple people question whether or not the vaccine, one of the side effects is that it could make them infertile or impact their ability to get pregnant in the future. I'm wondering if that's a concern that you hear from patients, or any reassurance that you could give us or that you give your patients, or just in general, some of those conversations that you work through your patients about, kind of this further discussion of this journey that you're on with them, kind of helping them through the unknown that we're all kind of doing to a certain extent right now.
Yeah, I'm glad you brought that up because I think that dispelling myths, arming people with the information that we have, making sure that they're making the decision with the best possible data is a really important part of our job. There is some misinformation out there, and this idea of the vaccine causing infertility is one of them. I don't know exactly where that came from. People are finding it on the internet, but there's no data whatsoever that either theoretically or in real observation that there's a chance for the vaccine to do that. I think people worry a lot about both short-term implications, but also long-term implications. And I just try and reassure my patients that while we don't have perfect data and they're going to have to make this decision with imperfect data, there's no signal in the safety information so far that it causes things like infertility, nor birth defects, nor some of the other things that they're worried about. And then I just sort of encourage them again to say, okay, you've got these theoretic concerns that we feel very comfortable with are not real risks, but you also have real and theoretic risks of being infected with COVID in pregnancy. So we've got to weigh those for you and help you to make the best decision for yourself, and then we'll support you. But you can see how that equation gets complicated
and I think, again,
when we
just
don't have
goes
perfect
back
data.
Yeah, to those conversations with your physician and kind of establishing that relationship where they can bounce ideas off of you. And of course, it's going to be a lot of anxiety right now for a lot of reasons, right? I think one of the last questions I had that had come in is if you have received the vaccine, would you then still need to wear a mask during delivery?
Yeah, that's a topic that we haven't actually directly addressed. I mean, we've always told people that we encourage mask wearing on labor and delivery for everybody, but we're also humane individuals who realize that sometimes in hard labor, it's just not possible to keep a mask on. So we're very accommodating with regard to women who are in labor in terms of making sure that they feel like what they're doing is reasonable. And if they feel like they can't wear a mask, they certainly can remove it. Plus, remember, we're asking people to be screened before they come into labor and delivery, and sometimes screened on arrival, depending on their unique situation. And so we feel quite confident that the pregnant woman herself is very unlikely to have COVID at the time that she's there. No testing is perfect, which is why we still have mask recommendations. But we really try to be person-centric and give personalized care and work with the patient and her family to determine what's right for them. And sometimes it's not wearing a mask while you're pushing.
Yeah, right. Exactly. My last question, and then I'll just see if you have any final thoughts. When we spoke before, I asked you if you had predicted that there was going to be a COVID baby boom in 9 months. So I'm just wondering if you have seen an increase in pregnant patients or in babies that are being delivered, because it was about 9 months ago that I talked to you.
Yeah, that's a good point. I mean, business in the obstetric world seems to be steady and never ending. We have not seen necessarily a boom, but nor have we seen a bust. Across the country, it seems like the birth rate has fluctuated a bit up or down, but overall things seem very steady. I mean, with all the uncertainty of COVID and being pregnant in the time of COVID, it seems like families are still primarily making the decision about having babies based on what's best for their family, and they're working through all the rest. That's my impression of the gist in the community.
That's great. Any final thoughts, Dr. Clark, to leave us with about, where patients are at and any advice to either pregnant moms or women who are thinking about becoming pregnant soon?
Well, I think my final thought would be to emphasize that we are sympathetic to the strangeness of the times and the dilemmas that families face. I encourage women and their families to bring these questions that we've tackled today and others to their healthcare team, because we always want to have an open conversation about what we know and what we don't know. And I'll emphasize, and I do emphasize to my own patients, that we're never going to strong arm you into doing anything that you don't feel comfortable with. And that is particularly applicable to the vaccine conversation, but to everything in pregnancy care and delivery care. That our job is really to work with you and your families, to arm you with information, to help you to make these decisions for yourself and to support you in those decisions. So we appreciate the opportunity to have a conversation about hard things and to help people walk the path that is pregnancy, delivery, and parenthood. It sometimes is not an easy path, but I just reassure women that no matter what happens and no matter what you decide, we're going to walk alongside you for every step of that journey. That's our job, and we're glad to be there.
Well, thank you so much, Dr. Erin Clark, Division Chief of Maternal and Fetal Medicine here at University of Utah Health. And we appreciate you all joining us this morning for Facebook Live. And we will do this again as we continue to learn more about this subject. Thank you so much.